So many things going on your end. Just wanted to know what are you up to right now in your career professionally, how things are going, and how did you evolve into all of these roles at the same time? So please start with that if you would.
Yeah, well, thank you so much for having me. And this is a fun venue, and I'm really excited to have a conversation today. Pharmacy is such a really dynamic world, right? And I love that there's so many different paths we can go down.
Right.
Um, I've always been one who wanted to find new things to do and kind of build and grow. And um, I'm a futurist and an optimist by nature. So I think the things that I tend to gravitate towards are associated with both of those things.
Hmm.
Um, Actually, when we chatted last week, I just started a new role, which has been really awesome and exciting, and just feeling a lot of growth and learning right now. And so I have a pretty non-traditional role in my full-time job where I
Yeah.
work full-time at a college of pharmacy,
Right.
but I have a combination of an administrative role in the college where I
Mm-hmm.
oversee student affairs, and perhaps that's a more traditional part of what I do.
Right.
I'm a faculty member, and I have my teaching responsibilities. A part of my new administrative role is helping to support community pharmacies throughout the state of Ohio and helping them implement patient care services, which is something that when I was in practice as a pharmacist, I worked in ambulatory care. So I early in my practice life, I was in a bunch of different settings, helping to grow, develop outpatient services, and then serving as the pharmacist in those different capacities. And so
Hmm.
I always found that growing those services was amazing, and the ability to connect with patients in those settings and have that continuity of care was something that I absolutely loved. I love kind of people and relationships by the nature of who I am as well. And so it's really exciting to have found this new way later in my career to give back to the profession and really help to allow pharmacists who are at the forefront and the front line
Hmm.
provide more patient care. And so, yeah, that's what I do in my day job.
Hmm.
Outside of
Yeah.
that, and something that's really close to my heart is coaching folks,
Right.
mostly pharmacists, and in that helping them develop and discover who they are, what they want out of their careers, where they fit best in the world, and started to expand a bit outside of pharmacy as well, just because I think there's so much opportunity for people to realize their true potential. And those outcomes really light me up as well. So, yeah, kind of a mix of a lot of different but related things
Right.
in certain areas. And starting this new role, it was actually October 1 that this role started. So, kind of in the midst of a big change right now.
Yeah, and I really love the coaching part, and I really love the providing value and the giving back to the community part, because oftentimes we are acting like a robot, right? We are working in our respective fields, doing a 9 to 5, or something that even we like, but we are just acting like we have to go to that job, get the job done, come back home, get our
Mm-hmm.
paychecks, and that's about it. Oftentimes we are not using our minds how we can bring a change in society.
Mm-hmm.
Maybe we can do something for people that can turn into great things, great personalities, and they can take it forward from there on. And if somebody like talks to me, maybe fresh graduates or pharmacy graduates, and they ask for help, how can we navigate in our careers? We are
Mm-hmm.
pharmacists, and what are our opportunities as a pharmacist, or as just professionals? So what can we do? What are our roles? So the first thing is that I say that find things that you like, you are passionate about. And I have also read, somebody said that when you do a job, you should be liking that job, and you should have a job that you like, not the other way around, that find the job and then develop your personality according to the job, but have a personality and make a job out of that personality, so
Mhm.
that that's right, like, you won't struggle in your job, you would actually like what you are doing. So you will be on vacation all the time but you will be liking what you are doing. So that's the whole point of it. And I think you have also helped some pharmacists start their businesses. Is that right?
Yeah, yeah. Things we don't necessarily learn in pharmacy school,
Of
but
course.
maybe a little bit. And I think for those who have that kind of entrepreneurial itch, or as you're referring to, job crafting, and
Yes.
one of my good friends, pharmacist Brooke Griffin, she talks a lot about job crafting, like creating your own adventure essentially,
Right.
and not necessarily fitting into a certain box, but rather finding those things that really energize you, and following that road. And it's so fun to help folks with the first steps of business development, because
Yes.
it seems so overwhelming, right? It seems like, oh gosh, opening a business is impossible.
Right.
But really, it's just a series of these tiny steps. And there's so many community resources that are out there that I know when I was getting started, I had no idea about, the Small Business Development Center, the
Right.
Small Business Administration, so many networking opportunities that are in your local community that folks just aren't aware of. Number one. Number two, like the steps to open your own LLC are not tremendously difficult.
Right.
It's
Right.
really not that hard. But when you don't know what
Hmm.
the steps are, it can feel very scary, right?
Of
Because you're
course.
like, I don't, opening, I don't know, I've never owned a business before. So
Right.
yeah, it's been fun to help. I think at least 12 different pharmacists now launch
Wow.
their own thing, and it's just a fun thing to also see how it's aligned with who they are and what they
Right.
believe to be important,
Yes.
and have that as a part of their personal and professional goals.
Right, and along the way, we meet so many people, they do not even know that they have it in themselves, where they're maybe wasting their
Yeah.
time and wasting themselves. A little mentorship, a little polishing here and there, they can really grow into very successful entrepreneurs and start doing what they're crafted for. So, things like that. And, you are really a good resource because I meet a lot of people, a lot of pharma professionals, and they ask me these questions that how should I start, where should I start from, and what should be my steps as a pharmacist, what are my career options, and things like that. So I would want you to be connected with those individuals as well, as we are growing our networks as well. So I can really take advantage of your help and your resources. But what advice would you give to pharmacy owners who are owning their pharmacies and looking to expand their services, and how can they attract more patients through the use of digital marketing, which is so big nowadays?
Yeah, I think it's such a really fascinating time to be in the world of, well, one, pharmacy, but then also digital marketing, and how can we educate the public not only about medications, but what a
Right.
pharmacist does. I think our professional and public image is something that the profession can continue working on.
Hmm.
Um, Even just in the education of, like, number one, the role of the pharmacist, the training of pharmacists, what we can provide for patients, and how we can help patients with the care that they're receiving throughout the healthcare system.
Right.
Building those relationships through platforms like social media, uh, through connecting with healthcare providers through these digital platforms as well,
Right.
and also getting information out there to patients and providers
Right.
in ways that we've never been able to do before.
Yes,
We
and
can,
it's so awesome.
yeah, it is.
And it's a free thing, free resource that people are not
Right.
using, and they don't think about it, and they just say, oh, social media, but I have a pharmacy business, so why would I be there? It's not just for fun, it's for providing information and maybe health tips, just communicating and connecting with your audience and your communities in a more casual and easier way. And it takes time, by the way. Organic social media, organic growth, marketing, it takes some time. And then I read just yesterday that if all things that are so beautiful, just like plants and fruits and vegetables, they take time to grow. But once you put that time and effort into that growth, it really flourishes and we get good results. So just like this, if they can use the power of social media, which is for free, they just do not want to maybe invest time, or they don't take it seriously. So these are some things. And as an advocate for, I believe, for the pharmacist, right? In the career development, what do you think are the skills that pharmacy professionals need to develop in today's age?
Yeah, I mean, I think to piggyback on our conversation just now, the communication skills that
Yes.
you need, not only in the in-person environment, but in the digital environment.
Right.
People want to develop relationships with the brands and the providers that they're working with.
Oh, yes.
It's so easy now to be able to do that with social media and develop your rapport and your connection with folks by showing up and being in that space where others are finding information. There's a lot of misinformation about medications, about healthcare in general. And I think us as healthcare providers have a responsibility and the capability now to really influence and be out there to bring the truth to people.
Right.
In a way that we've never been able to before. I think another thing that I know we talked about and that I see coming in healthcare change right now is that having a good understanding of reimbursement and how the business of healthcare operates is going to be a advantage for folks who get involved with really any aspect of pharmacy. Having those basic understanding, even foundational understandings of business principles, of how healthcare is reimbursed, can really give folks a leverage in the workplace.
Of course.
And they may discover that they really end up enjoying it. I know for me in pharmacy school, in our business class, I'm like, when will I ever use this information?
I know. And even the people who are studying, the
getting into
undergraduates, they need to learn skills now rather than later.
I totally agree. The more that you can dive into it, the more you can have that mentorship. When I got into practice, I realized immediately how vital these skills were. Like, I could be a great pharmacist with medication knowledge, but if I didn't understand how that medication was going to be covered by insurance, then it did my patients no service. If a patient had a medication that they couldn't afford or that they couldn't access, it didn't matter, what my recommendation was. It mattered that that patient wasn't going to be able to have the help that we thought that they would. So I think regardless of where you sit in the profession or in any healthcare space, if you have that understanding of how the business works, you can also leverage it to
I think
expand services.
even the healthcare services or any profession, it is so important. If you're an accountant, you are a doctor, you are anything. It's so important. You are an IT person, you are an engineer. It is so important to have skills while you are obtaining that degree. So
100%.
So you without that, I mean, I believe you are half done. The other half is that you have to have your skills in place while you are studying. So then when you graduate, you already have those and you already have meaningful connections. You really know the roadmap, and then you just have to act practically on all of those things. And it has opened up so many opportunities for me as well, just LinkedIn, because I spend most of my time on LinkedIn, about
Mhm.
several
Yep.
hours every day. And just as I told you, I spoke with Nadia today. Nadia is in the US. She is in Kentucky, right? And I am in Canada, here in Edmonton. So I would have never discovered that she exists
Right.
there, and she's doing wonderful things. She's a pharmacist as well, and she was telling me about all of these technologies that I can get help with her experience as well, because I can tell my independent pharmacy owners that these are the technologies that are being used in Nadia's pharmacy, and it's bringing them great results. And as a digital marketer, the more I speak with more people, the more I learn, and the better I can help my clients. And I get connection requests for the graduates, people who have just started their pharmacy journey, and they ask me about their career navigation and their career
Mhm.
growth, and what options do they have as a healthcare professional, as a pharmacist. So it's all because of I was visible. That's why it is possible. If
Mhm.
I wasn't there, I wouldn't be having those opportunities, and those people, they wouldn't get that value that you and me can share with each other or with the public that's there.
Yeah, I this platform. So I, in my role in the college, I have my students create a LinkedIn profile as an assignment early in their curriculum, and then we use it throughout the curriculum for networking. And so I try to instill that kind of practice within them while they're with us, so that hopefully they'll continue it down the road. And I do have students come back post graduation and say, I found my job through that platform, or I met this really amazing pharmacist who was doing something I'd never heard of before.
Right.
And so I think it's wild to me, and it's
Yeah.
awesome that it's still, a free platform that you can just join. I'm like, this is worth so much value
Right.
in a lot of ways. So yes, absolutely.
It's so much value. And then even if you are a pharmacist, it's not just a traditional pharmacist that you just have to be behind the
Mhm.
counter, just counting pills. There are so many things that you are doing as a pharmacist. So just like people, they have skills, they have a degree, but then they have some skills, so they just need to polish those skills and just believe in themselves. And I think it can make you money, and it does, because some people are worried about the money part, that hey, we are spending this much time on social media, but what's next? Are we just doing it for fun and just spending some hours, or are we building something? So my response is, and then as I have learned from my mentor as well, that money follows if you are doing just the right thing. If you are providing value, money really follows, and on the way you are building yourself, you're building a platform, and you're documenting your journey, as well as making you a brand. So branding, personal branding. So this is a powerful thing that nobody talks about. People
Yeah.
are, yeah, they're just busy doing their jobs. So doing
Mhm.
their jobs, either getting fired or getting retired, but then in the end they are not a brand. But LinkedIn and social media is giving us a free opportunities to build our brand. And we have our friends here, Hafiz and Aisha. They are both great business people. And yeah, if they want to say something, they can join us in the discussion. We are just discussing about the power of digital marketing, pharmacy related, and non-pharmacy as well. How the professions are evolving now, that if we are pharmacists, we just don't have to be a pharmacist. We can do so many amazing things that I am seeing, and I'm really amazed because on LinkedIn I meet people around the globe. They're pharma professionals, but what they are doing is worth sharing, and I love these kind of discussions because it's opening a lot of doors for myself as well, and it's all part of learning and building, and it's just amazing like what people are doing nowadays. So I just want like nobody gets left behind. Everybody should be taking value of all of these things. So yeah, that's what I wanted to say about it.
Yeah. It's like that quote, your network is your net worth,
Yes.
right? The more that you build and grow and learn from other people as well, the more
Yes.
diverse that your world becomes, the more perspectives you have to consider.
Right.
I only see huge benefits to doing things like this. So
For
I'm so
sure.
glad that we have platforms to be able to have these conversations.
Yes, otherwise we wouldn't have connected. You wouldn't even
No, I
know
know.
I exist, right? So it is amazing. We also have Muhammad Haris joining us here. So all of our friends here, and you are also an advocate and a teacher for teaching in advocacy and coaching for pharma professionals. So what do you like? What are the messages you want to really give to the pharma professionals? In and the next generation of pharmacists and the people that are in the pharma industry right now for using the digital tools, and how and why they should be using these platforms.
Yeah, I think, something that we talk a lot about in education is how do we make sure that our graduates are ready for the workplace? And with everything happening in digital health and artificial intelligence, how do we know that we have learners who are developing the necessary skills to thrive and really be a part of the workplace in a productive way, but also in an innovative and forward-thinking way? As we see, so many healthcare workplaces now have digital tools. They have artificial intelligence built into what they're doing.
Oh yes.
They're expecting that everyone coming into the workforce will have a baseline understanding of what is available, and so we are incorporating a lot of that into our training now, and also talking about the risks that they can introduce as well. So with AI, for example, where ChatGPT pulls information from isn't always great information. In
Right.
fact, it can be very biased. It can be incorrect. It can be the wrong answer because you gave it the wrong prompt. And so, not only sharing with folks, the power and the benefits of these platforms, but
Right.
also what we need to be cognizant of, because there are
Mm.
definitely fallacies that are inherent to data that is missing information or is biased by the nature of what we know to be
Right.
research and data that's available publicly. So while, yes, we want to make sure that students know that they should and can use these things, how do we equip them with the judgment to know when it's appropriate, to know how to use it in a way that helps increase access and increase equity in healthcare,
Right.
while recognizing the downsides of what the current state of these tools is, so that we have safe and effective healthcare for all.
Right, exactly. And the whole point is that our future generation, as well as the pharma professionals right now, they need to adopt and learn these skills. They need to learn how to use automation, how to use
Mm-hmm.
these tools, use the AI, right? Because it can save them time, and time is money. If they are not using it effectively, they are working so many hours but doing the wrong task, like something that the AI can do for you in a couple seconds. You are spending the whole day doing that. So this is something to consider, and this is in our traditional pharmacy books. When I was becoming a pharmacist and reading, I did not, well, it wasn't out there so much, but then even
No.
now I do
Yep.
not know if people are learning AI because they are thinking that they are becoming pharmacists, they're not becoming IT professionals. Why do they need to learn AI? But everybody should learn AI and how to use it. It can save so much time.
Yeah, we have it in our curriculum now. I would say even 2 years ago we didn't. And we are building that up all the time to make sure that we're helping our students develop those skills. It was interesting. I went to a conference this summer about AI, and the keynote speaker shared a lot of thoughts, but one that stuck out to me that resonates with what you were mentioning is, there'll be risks to using AI, but then there will be risks to not using AI.
Of course.
Because if AI practices become best practice,
Right.
then it will be an expectation of healthcare providers that, well, why didn't you use that AI tool? It was available to you, and
Right.
it could have provided better patient care.
Of course.
Or on the flip side, you used an AI tool inappropriately,
Yes.
and now the patient care was not as optimal. So it's a really interesting time to be a part of this change that we see in healthcare, and to see what happens and the integration that will benefit. And my hope is that ultimately it does benefit patient care.
Right, and we have Hafiz. He'd like to say, and he's a great business professional. So, Hafiz, you can unmute yourself. How are you doing today, Hafiz?
Thank you so much, Anand. It was very interesting discussion. I'm fine, thank you, and I hope you both are also doing great.
Yes, thank you.
Yeah, thanks.
Yeah, I just wanted to know and share your views. If you use any of your organized AI systems specifically for your empowering your pharmacies marketing business, or actually driving the value out of any organized AI system specifically for the pharmacy?
Yes, so okay, so you are asking if we are using any AI tools for the digital marketing that I am doing. So there are actually many. There are actually some automated review response tools that the pharmacies can use, where they are their customers, the new and the previous customers, they can leave them reviews, which is automated, that the moment they step into the pharmacy and then they are leaving the pharmacy, after a few seconds they can get an automated review request to give them some rating. So that really helps, because in the olden times we are asking each person, hey, please leave us a review, but now they're just getting it in their phones that you have to leave a review for the pharmacy, so they can leave them a review. And other than that, they're also using like so many calendar tools. They have the email automation tools, where they can send to their potential clients and their patients news about their pharmacies, as in some health tips and some flu season, the dates when they are holding the flu shots, all about that, the things that the pharmacy patients should be knowing, their community. If they are opening up a new service, they can mention that. Other than that, if they are working with a physician, they can mention that. So those kind of things. We also have the SMS automation tools, where the people can get SMS, the appointment cancellation, appointment confirmations, things like that. And of course, the automation for social media, where the pharmacies can post on social media like multiple times a day, where they are not doing it themselves, but they automate it. They write some content, and then the content is scheduled on the calendar, and then it gets posted multiple times the day, or however they want it. So this is all power of automation. And as well, we also have bots replying to customers. When you go to a pharmacy's website, you don't have to call the pharmacy and ask them questions like, what are your business hours? Are you providing flu shots? Do you have certain medication in your pharmacy? And some common questions. So they don't have to hire a staff for that. The bot can answer these people all of these questions, and then later on, the pharmacist or the pharmacy staff can see who asked what, and then can directly also reply the customer or call the customer if they were not satisfied with the bot's answer. So these are amazing things, and this saves a lot of time and money, because you don't have to have your staff engaged for doing all of these things. So I think these are lots of amazing things. So what do you think, Jackie? Do you know of some of these tools, or are you using these?
Yeah, so I'm a little bit in a different space because I'm supporting the pharmacies. I'm not in them, but we do use CRM tools, so customer relations managers, so that we can send out email communications to the appropriate group of pharmacies that we're working with. And those are really helpful. You can obviously like schedule things in there, but also tailor the communications towards certain groups that you're targeting. Other things that I know pharmacists are doing are using like Google Translate to work with patients from different backgrounds in order to communicate with them and provide them with information in their language. I've actually seen a few demos of real-time educational AI tools where you would ask the AI technology to develop education, let's say for a child who has asthma and they're also a non-English speaker. And so let's develop this education in a way that's not only in their language, but is at the appropriate communication level as well. And so I think AI, again, I have so many hopes for how it's going to transform patient care. I just want to make sure all of the risks are mitigated and managed so that we're not putting anyone in harm's way.
Yeah, and this is just so amazing. And then translation service that you mentioned, this is mind blowing. Oftentimes, we do have immigrants. I myself an immigrant, so people who are non-English speaking, or we can say non-French speaking, if they're in Montreal, they can have a tough time because when I traveled to Montreal, I was in an Uber, and the Uber driver was speaking in French, and obviously I do not know French, so I was using a translator in my phone to answer him. So
Yeah.
things like these in the healthcare system means a lot. When I was working in a pharmacy back in Chicago, and there were people from Burma. There were lots of immigrants coming from Burma, and they could not understand English. They were speaking their language, which is, I think, Burmese, and I was not able to understand a lot of it. So obviously, the patients they were having some hard time getting the care, and I was just speaking, trying to understand what they're saying, but I was feeling so sorry for them that what if I could provide them a better solution. But now I think it's possible with the use of AI, which is mind-blowing. I really love it. We have Jess McCullough, we have Leah. By the way, with Jess, we had a podcast earlier, and you can find it on my website. It was about leadership in our role as pharmacists, or just as business professionals, or just human beings. And Jess spoke a lot about leadership, and I learned, and my audience learned a lot through Jess's discussion, and just mind-blowing how this social media is connecting lots of people together. And I'm just loving how we are navigating it and how we can take value from all of these things. So very nice. And you're also an advocate for a work-life balance, Jackie, and wellness. So, what about the pharmacy professionals? Are there also any digital strategies to not even just promote the business, but also take advantage of that and use it for our health and wellness, that can resonate with the community, and we can let the people know as well? And then just for us as pharmacists, are there any things in place we can use to have a peaceful mind for ourselves, which will have a peaceful body, and just for a professional use?
Yeah, well, and I think I reflect back to my days in direct patient care, and I remember, being in the physician's office, and every time I walked in, usually number one, patients were like, "Why are you here? Are you bringing me my medications?" And I'm like, "Oh, actually, I'm a pharmacist who does something a little bit different. I work with the provider directly, and I honestly want to get you off of as many medications as possible. I want to make sure the ones that you have are the ones that you need, and that things aren't being used to treat side effects and you can afford them, et cetera, et cetera. And so I think patients were always surprised that I'm like, no, I don't want to add more medications. In fact, let's see what you can manage by, looking at lifestyle modifications, or if you're having trouble sleeping, like, can we look at things like your sleep hygiene, and make sure that all those non-pharmacological things are also things we can address without adding another treatment to the regimen. And so I think, as pharmacists, we can also be the ones who share those educational wellness tips through things like social media, or if we have a blog, we could host wellness events for our community and talk about preventative strategies, so that, we're not always so reactive in healthcare. We wait until patients have the disease or they have a exacerbation of that disease.
Right.
And that is the worst part of the healthcare trajectory. And if we as a community, not only pharmacy, but all providers, can focus on that prevention and wellness piece, then I think overall we'd have a healthier world. We all know too that there's a lot of discussion right now in the healthcare field with all healthcare professionals that burnout levels are high. We saw during the pandemic this escalated tremendously,
Right.
And now we're in a I don't know if I'd call it post-pandemic world. We're in a different world, but we still see that the demands on healthcare providers are very significant. And I think of the National Academy of Medicine's Clinician Wellbeing Initiative that started pre-pandemic. It was 2017 when they brought the group of signing organizations together to say, we need to focus on taking care of our providers. At the center of everything, of course, was still patient care. But ultimately, if we're not taking care of the providers that are delivering that care,
Yes.
we're not going to have a workforce to provide that healthcare. And so I think the awareness that that's a problem is important, but then also organizational attention to making sure that the workforce is healthy, and that there's ways that are built into the organization's culture that folks can feel comfortable speaking up if they're having feelings of burnout, or if they're having mental health challenges. I think normalizing those conversations is helpful, but also ensuring that providers have the outlets that they need, that they're taking their PTO, that they're not working a tremendous amount of hours outside of their normal workday. I think the more that we can pay attention to these things and have hard conversations about this in our organizations, then the better off that we can, one, take care of the existing workforce and retain them, but then also attract future practitioners so that we have a pipeline to a thriving workforce, and we're not going to be at tremendous shortages that are predicted right now.
Right. And I think it's all the matter of leadership as well. In many businesses, we do not have great leadership. We are not leading the way, just like Jess says. We are not leading the way like we should as a staff member, maybe as a supervisor, as a pharmacist, as a manager of the team. We should be asking some simple questions to the staff, that how they're doing, how was their day, are they having any problems, maybe professionally, maybe personally, how are they mentally, how are things going in their life, in their family. These simple questions, this is not wasting time, but this is actually investing your time into meaningful conversations. And I think you learn a lot while on the way, and then you help people. You should not just treat them as staff members, but treat treat them nicely, and then maybe they can be your best staff members and helping you in the business in the best possible way. And as you said, we should take care of ourselves first, I would say, because as I have read, and I always follow this, that you cannot cut your hand to help somebody else, right? If I have my hand, only then I can help somebody else. So when we are stable mentally, when we are happy, and when all things are going smoothly in life, we know there are ups and downs, but at least to some level, how can we go into the field, especially healthcare, and help other people? It's very important to take care of ourselves, take the PTO, yeah, take the paid time off, take vacations, take time for yourself. Don't just be a machine and work. People are sometimes workaholic, and they love their profession so much that they forget about themselves and their families. But it is important to take some time off and do something that they're passionate about. Go for walks, go for hiking. In Canada, we will be having snow soon, so that won't be possible, but go to indoor gyms, find some activities, find some community, some friends that can share similar interest with you. So do spend some time doing that, or at least try to do that. That's what I want to say about the mental health. It's so important.
Yeah, and I love what you said, Anam, about leading and walking the walk and not just talking the talk. So you can tell your staff to do all these things, but if you're not doing them yourself, that also sends a message. And so I've been fortunate to have mentors who have kind of shown me the way, and I try to emulate that for my team because I care about them, and I also recognize the need to have self-care, because you can't pour from the empty cup, so to speak. If you're in a profession like ours where we are givers by nature and we are trying to give from an empty vessel, there's not going to be anything to give, and
yes,
that will certainly be the recipe for burnout.
Yeah, and if you guys, Aisha, Mohammed, and Jess, if you guys want to join the discussion, you're welcome to do so. And of course, you are also a coach and pharma advocate, and as we were discussing about immigration and immigrants as well, right? So what about diversity, equity, inclusion at work? When we talk about these things, how should we make our businesses welcoming environment for patients from all over the world? How can we make it more diverse and more inclusion? What do you want to say about this?
Oh, there's so much to talk about here. There's so much.
Awesome.
But we know that organizations that are more diverse have better outcomes. We know that healthcare providers who are more diverse have better patient outcomes. Patients do better when they're taken care of by individuals from their community. And I know in pharmacy, we have definitely a long way to go in ensuring that the workforce is reflecting the patient populations that we're taking care of. And it's exciting to be a part of, work towards that. And I think there's a lot of work to be done, even from K through 12 education. I am involved with our local community school district, and even looking at the disparities that start as early as kindergarten from educational opportunity perspective are staggering. I think maybe very naively, I thought, it starts at college is a big gap of educational opportunity, but it is way earlier than that. If we are to build a workforce that is truly reflective of the patients that we're serving, it's got to start so much earlier. And even in working with parents who are taking care of children in the community, how do we make sure that they're in the conversations about, how do we get your children to different educational pathways? How do we make sure that they have access to all the things that they need to pursue whatever path it is that they want to do in life? And I think, gosh, there's such a big opportunity even within our local ecosystems to break down barriers, to increase opportunities to access careers, and then also accessing healthcare itself. The disparities that we see. I know one, so I am in Cleveland, Ohio, and one stat that I will never be able to unhear is that there's a city called Lyndhurst. It's a very high socioeconomic area, about 8 miles from Cleveland, Ohio. And the life expectancy between that city and a city 8 miles from them, East Cleveland, the gap in life expectancy is over 25 years.
Mm-hmm.
And like, to me, that's unacceptable. So unacceptable. We have tremendous healthcare systems in our community in Ohio,
Right.
which we're very fortunate for.
Mm-hmm.
But how is it that the disparity is that large in an 8-mile radius? That should that keeps me up at night.
Yeah.
Like, how is that the case?
That's very
And what
unfortunate.
are we doing in our communities to address issues that are literally right in our backyard?
Right.
So there's so much to dive into here. I'd love to hear if folks in the room have thoughts and other things to contribute, because I think we could probably talk about this for hours.
Yeah, and we have Jess here. Hello, Jess. How are you doing?
I am well, Anam. How are you?
I'm doing great. We're having a great discussion here. It's good to always have you join us.
Well, it's good to be here, Jackie. It's a pleasure to meet you. And I think that you and I are actually pretty much neighbors. If you're in Cleveland, if you're in Cleveland, I'm about 2 hours from you in Northwest Pennsylvania. You bring up so many good points about just the diversity and so many of those challenges and opportunities that exist in the marketplace. But I just wanted to get your reaction or your thoughts, because there's a kind of diversity that I don't think gets enough attention, and that's around age. The way I typically tell this story is when I first became a pharmacist, I was about 25 years old. I was asked to lead a team of people who were twice my age and provide care to people who were 3 times my age. And while I had all sorts of clinical knowledge, I did not have the very practical knowledge to be able to connect with those people and to be able to, help them get to the places where they needed and wanted to be. So I just wanted to throw that out there and just sort of get your thoughts or reactions, if you would, my friend.
Oh, it's so great to meet you, Jess. I'm excited to get to know you. I have a feeling we'll chat after this. And it's so interesting that you brought this up, because I have 2 students who are working in their final year of pharmacy school. They're with me this month, and we were talking about the topic that they wanted to they have to do a presentation to our college about something. And something that I've heard brought up in almost every pharmacy conference I've been at recently is generational differences in not only patient care, but also in the workplace. And how do we navigate these in a way that is productive for all of the generations? And it's something that I think is wildly under addressed. We have multiple, I think 4 generations right now in the workplace and the timeline, maybe 5 with Gen Alpha. And we still don't have great systems for these groups to interact in a productive way that recognizes the differences and the goals, the values, even the society in which these generations all grew up in, and the influences that they had in their life. And so this is another huge gap in diversity. I agree 100%, Jess. And I definitely don't have all the answers, but I think there's a lot more attention that needs to be paid towards how do we recognize and celebrate the diversity that different generations bring to really every environment.
I agree. I think that this is perhaps the confounding factor that makes so much of the other things that we do so much more challenging than what we would need or want them to be. Right? There was my kids. I'm reasonably sure do not know how to write in cursive. And when my parents give my kids a birthday card and it's signed in cursive, like it's like they're reading a completely different language, right?
Oh my gosh, yes. My daughter's like, I can't read this.
Yeah,
like, what do you mean?
It's such a simplistic example, but it's something that can just be multiplied, exponentially across all of society, right? And I tend to look at things through a leadership lens, and my philosophy would very much be around, it's the leader's job to make that connection. And when we have people coming out that are not equipped with the skills to make that connection, we should not be surprised at all. We should not be surprised at all when they become frustrated, and then that leads to those different burnout type symptoms. So thank you so much. Appreciate your the opportunity to chime in here, and look forward to talking with you more offline, Jackie.
Well, same to you. And that's such a great point. I mean, I reflect back to my late grandma, and, we're talking about getting out into social media, getting messages out there. I mean, this woman didn't touch a computer. she did not want to. She was not interested at all. And there is no way any of that would have reached her in any way, really. She refused to be a part of it. So I think as we think about all the digital tools that are available and emerging, we have to be cognizant of this framework.
Yeah, I agree. And just as I said, I was speaking with Nadia this morning. She's also a pharmacist in Kentucky. So she said that she is there working in Walgreens pharmacy, and it's basically a smaller town where they have these automation processes going on in these pharmacies. And there's like two types of generations there. The younger generation, they are okay using the online and automated tools. But the people who are in their 50s and 60s, some part of it is that they do not want to use those. They want the healthcare provider, the pharmacist, or the staff member to do all of the things for them. And the other reason is that they do not know how to navigate through simple tasks like navigating the app for the pharmacy and for the drug refills. So these are some of the things as well that we should be touching, because these are so important, just spreading knowledge and information that how these tools can simplify their life. When we also talk about diversity and inclusion. So, of course, people are here in Canada, even in Edmonton, I see people coming from all sorts of backgrounds, so many different countries, some countries that I do not even know about, right? I heard the name for the first time, but they're here. So it's amazing. And I think these are digital tools which can bring people closer, as well as maybe learn how to use these just to make life easier for themselves and for the healthcare profession as well. So yeah, this is amazing.
Yeah, and I think about, we have a lot of, and a growing population of second language learners in our educational community. And we're very fortunate that we have a second language learning specialist at our institution. And in talking a lot with them and both our staff and our students, English is just the tradition of language that has been I guess maybe forced a little bit, but how do we celebrate all of the languages that are in our community? And do we need to have all of our assignments written in English, or can we say, hey, write this one in your native language, and then be able to translate that on the back end for the educational system to say, let's actually celebrate. We have 39 languages at our institution. Like, can we highlight that is really amazing and celebrate the diversity that something like that brings to our community, and the strength that comes from knowing multiple languages as well. I remember talking with a student who knew 12 different languages. I'm like, oh my gosh, like that
Wow,
is just so
that's
fascinating.
amazing.
Right. And I'm like, I know one and I'm okay at it, but going through a very complicated curriculum in a different language, and maybe it's your fourth or fifth language. Wow, that
Right.
is something that is a
Remarkable.
phenomenal strength to be
Yes.
celebrated, not something to I don't know. We need to celebrate that more.
Right. And then one solution perhaps we have is to include people into our business, welcome them, and hire them coming from different backgrounds, and the people who know different languages, right? So this is a plus point. Like people here who are Arabic speaking or are French speaking, we need them in our businesses, because we have a big population of Arabic speakers here, people who know French, by the way, people who know Hindi and Urdu, which is my language. I'm from Pakistan, so people from India, they understand Urdu, Hindi and Urdu both, right? So if we include and give them a chance, employ them more into our organizations, that is going to help our businesses a big time. People usually fail to realize that. This is maybe power of collaborations, people coming from different backgrounds. It's always good and benefiting your business, because now you can easily serve other people, your customers, who are also sharing the same background as your employees. So this is one thing we should also take seriously.
Yeah, I agree 100%. And there's still lots of work to be done in our organizations to get there. I know there's a lot of best practices available throughout the country and even internationally as well, but still a long way to go to close the gap on equity in our workplaces.
Right, no, I understand that. And I think now we are coming towards the end of the discussion. Unless anybody wants to add something or join the discussion, Aisha, Rizwan, Asad, Abby, Jess, Jackie, I also want to thank everybody who's listening, and everybody who has joined us today and has made this discussion so much more meaningful. And I look forward to hold more discussions like these to connect more people together because this is one thing I love. So thank you so much for joining. And anything Jackie wants to say?
Oh, just thank you. This was so fun, and so glad to have many colleagues here to chime in and be with us this afternoon. It was a pleasure.
Right. Thank you so much, Jackie, for your precious time. Thank you, Jess. And thank you all of our listeners. This has been a great discussion today, and I will be uploading the recording on my website soon for folks who have missed it, or people who would like to take advantage of this wonderful discussion. Thank you so much, and I will see everybody next time in my other live podcast. Thank you, and bye-bye. Have a great day, everybody.